Good afternoon. Today we will discuss Martha E. Rogers and her nursing theory and how it relates to nursing practice today. A little bit about Martha Rogers. She was born in Dallas, Texas in 1914. She received her nursing degree in 1936 and then went on to pursue a public health nursing degree in 1937. Her theory of unitary human beings views nursing as both a science and an art. Its uniqueness to nursing, like any other science, is the phenomenon central to its focus. The purpose of nurses is to promote health and well-being for all persons wherever they are. The science of unitary humans began as a synthesis of ideas and facts. And in her theory, patients are considered unitary human beings. They aren't divided into subparts, but they must be looked at as a whole by those who take care of them. And according to her model, patients have the capacity to participate knowingly in the process of change. And then the environment surrounding that patient is also irreducible and coexists with human beings. And in this model, humans are viewed as integral with the universe. That is, the patient and their environment are one. Her theory really focuses on four major areas. The first being the role of the nurse. And in order for our patients to get better, we ourselves must take care of ourselves as nurses. If we are serving people, we want to be at our best so that burnout does not result and patient care is ultimately compromised. Burnout is something that we see in our facility where I currently work, and we do take approaches to try to prevent that. We meet on a weekly basis with our nurses, and it also includes our leadership team of administrative nurses and then our social worker, who is there to really provide mental and spiritual support to our nurses. And we also offer free mental counseling to our employees if they feel that burnout is becoming an issue. And so I really feel that Rogers' model is useful for addressing the issue of nursing burnout. And we know that burnout can lead to exhaustion and thus affect patient care. It can also lead to many med errors. It can lead to poor decision making as well as unfortunate deaths of our patients. She also really focused on non-invasive modalities for patients. And some examples of those are touch, humor, music, meditation, guided imagery, and use of color. At the nursing home where I work, we have a lot of outgoing employees who are not afraid to give patients a pat on the back, to hold their hand, to put an arm around their shoulder when they're having a tough day. We also try to use humor as a means to help our patients in the recovery process. I work in a skilled care unit, and while some of our patients are demented and are here to live until they pass away, we do take care of patients who have come straight from the hospital and who will receive therapy and nursing services and will return home eventually. So the needs are various here, but we do use different approaches with our patients to see what they respond best to. We have a lot of patients who love to laugh and who love humor. They enjoy music. A lot of my patients here know that I'm a singer, And even though some of them are demented, they will often recognize me as I'm coming down the hall and will ask me to sing for them. And so I do that because I do believe that it does help people in their healing process. And then we use a lot of color in our facility. Our facility is a colorful place with a lot of color on the walls, colorful furniture. We recognize the fact that drab surroundings will also affect a patient's level of depression and ultimately the healing process. And then we also have a day where our patients are able to go into the activities room and are able to paint or draw. And so we use all these different techniques for our patients in their healthcare journey. And then nursing practice is an area that she really focused on, particularly in the area of pain management and psychotherapy for rehab. Pain management is a big one here at the nursing home. We have patients who are on hospice care, and we try to do a good job educating our nurses about recognizing the signs and symptoms of pain, particularly in those who are not able to voice it. They may be aphasic from a stroke. They may not be able to express their needs from dementia. And so we educate our staff about looking for nonverbal signs and symptoms of pain, such as grimacing, being tearful, being aggressive, maybe they're pinching, they're kicking. And we teach our staff what to look for and how to go about taking care of those type of patients. And then Martha Rogers also used the nursing process for her theory, and we all know that assessment and patterning and evaluation are critical components in that nursing process for a patient's plan of care. So how her theory affects my daily practice as a nurse. And I added a few things here, but I've just mentioned several ways that I think it affects me daily. Rogers was critical of technology at the time. She felt like it would replace face-to-face nursing interventions. And I think that can be true. I think we can sometimes be too focused on our computers, but we know that that is a necessary component in our day, because if it's not charted, it was not done, as in the care was not delivered. So we stress the importance at our facility about charting our nursing actions. She also appreciated advances in nursing science and the increasing nurse scientists, particularly those who were studying the non-invasive techniques that we just discussed, such as the music, meditation, touch, etc. And one thing in particular I think that she entertained was the benefits of skin-to-skin touch of kangaroo care for premature infants, and I believe that is still emphasized in the hospital maternity wards as well. Her view of mankind was that of continuously evolving within the expanding universe. She emphasized that nursing is a learned profession that was both a science and an art, as we previously discussed. She also thought that with the internet and globalization of mobile technology, people would eventually be able to access information, innovative ideas, and tools from anywhere, including space. And she was exactly correct. We have all this information at our fingertips that we didn't have even 20 years ago. But it has definitely, I feel, benefited our patients because we are able to look up medical information pretty quickly, and which helps us assess our patients and assist in treating them as well. And of course, I went into nursing believing that the patient should be treated as a whole. We're not just treating their physical aspects of problems that they come to us with. We are considering their mental, spiritual, psychosocial, cultural, environmental factors, and we should also consider traumatic events, as well as biological factors that affect their health and wellness as well. And this is something that I plan to continue doing as an advanced practice nurse, because these are things that the Department of Health here in Tennessee really focus on during our annual surveys. And one of the most recent things is doing a trauma assessment on our patients to see if they had trauma as a child and how they've dealt with it and how it affects them now, what triggers their emotional trauma if they did experience it, and how that's going to affect their healing process if they come into the nursing home, say for rehab, and plan to go home. So that's a new aspect of the patient that we are dealing with at my facility. And so I'm excited to see where that goes and how we're able to help our folks to be able to heal, not only emotionally, hopefully, to some degree, but also to help them heal physically. And of course, education is huge. That is part of my role here at the nursing home as well. And teaching is a big one for me, and so my plan is to teach our families and our patients about ways to prevent infections and other serious health issues and complications. And of course, her application of science of unitary human beings included practice, education, and then research. And her theory has been used in many research works and has always been found testable and applicable. And then, of course, the nursing process with this theory, she looked at pattern appraisal, mutual patterning, and evaluation. And one of the big things that we do here at the nursing home is to look at our patients, look at their routines that they're used to, and we try to put interventions in place that allow them to continue to be as independent as possible with their choices from day to day. And then we evaluate those things. Were they effective? It's not just the medicine we're evaluating. We're looking at the entire picture of our patients. So this model is applicable in all settings and every sphere of life, and it leads to a new way of seeing the person as a unitary human being and a new style of nursing practice. And I've certainly enjoyed reading about Miss Rogers, who is from the state of Tennessee, where I'm from. And I think the biggest takeaway that I had from reading about her theory is that her approach to nursing frames the work in a new light. And while many nurses have strong motivating factors when entering the nursing field, seeing the results of what they do as being greater than the sum of their parts and having a rippling effect out of the environment can help them remain focused even during mental fatigue. And so furthermore, applying her theory to nurses themselves can help management see the need to allow nurses to rest, There is no wisdom in having an overworked staff. And since Rogers promotes understanding the connection of a patient to the environment, an application of her theory in this context would allow administrators to see that nursing staff are in fact a part of the patient's environment. If the staff aren't healthy, neither will the patients be. So we are approaching our time of the year where we have an in-service on patient care related to staff burnout. So I will be using this theory to guide our practice here at the nursing home so that we can hopefully recognize the symptoms of burnout and prevent adverse effects on our patient care. And I hope that you have enjoyed today's presentation. Thank you.